Hello, and thank you for joining us for this year's Family Forum series, where the Sioux Falls School District and experts from our valued partners at Avera Behavioral Health offer practical advice to strengthen families. We were excited that the Family Forum sessions offered last year were viewed thousands of times by parents, and we are pleased to continue this partnership with Avera again this year. We are so glad you are investing time to help your child navigate the daily successes and challenges of growing up. As a father of two who are now young adults, I know it's not easy. Schools and parents need each other to influence positive behaviors so students are able to learn and grow at our schools. Whether it's advice on balancing activities, coping with anxiety, or how to safely use social media, on the third Tuesday of every month, we bring you relevant topics and advice all parents can use. We hope you find this information offered by our presenter valuable and are able to apply it in your own home. These sessions will last about 30 minutes. So let's get started with tonight's topic.
I'm Wallace Jacklin. I'm a clinical psychologist and director of psychology here at Avera Behavioral Health, clinical social worker. I've been here at Avera for about 23, 24 years, been in the field about 32, 33 years. And today been asked with the Sioux Falls School District to present on Attend to Succeed. When does worry become school avoidance? So some of what we're going to talk about today is anxiety, depression, correlation between the two, comorbidity, and how that might translate to issues as it relates to school attendance. And maybe even if you talk about a little bit about some treatment options that may be helpful in working with individuals that may have some school avoidance or anxiety issues. So when Attend to Succeed, when does worry become school avoidance? This is one of our 2023-2024 Family Forum series, conjunction with Avera and the Sioux Falls school system. So first, I wanted to start talking about stress. You know, what does stress really mean? And so we know that it's a mental, emotional strain, tension, adverse, very demanding circumstances, something that causes really strong feelings for folks. And it may come out as a sentence of somebody saying, you know, I'm just been grumpy, but there are a lot of stress lately. Well, there's a little bit more to it than that. We're talking about two main types of stress. The first stress we talked about we'll talk about is called acute stress. And with acute stress, we all have acute stress. That's when something just happens throughout our day. You're trying to get on the off ramp and there's construction and you can't get around it, and you have to go around town and you're late for work, or you know your alarm clock didn't go off on your phone, and that's acute stress. And so most of us are going to deal with acute stress. Chronic stress is stress that has occurred over a longer period of time. It's stress that just doesn't really go away. So it's a chronic condition. In fact, you could almost argue that young people, especially, I'll just use the example of a junior in high school, they're likely under chronic stress, especially if that junior is considering going to vocational training or maybe in the military or thinking about going on to college. Boy, that junior year of high school is going to be really difficult for them. So that's a chronic state of stress for that young person. And so it'll be important for those folks to manage their stress. Otherwise, it can lead to health problems, which we'll be talking about here a little bit later. So what are some warning signs? As a parent, as a caregiver, as a spouse, as a cohort or a colleague, what are some of the warning signs you might see in those individuals? They might have increased arguments, a blunted affect. All that refers to is they just kind of like stone-faced, just concrete-faced. There's no affect to their emotional on their face. Increased risky or harmful behavior. It might be kind of hard to differentiate that with some young people because it seems like sometimes they're always doing some risky kinds of things. But I would say something outside of the norm. That's what you would look for. Or difficulty relaxing. That maybe, you know, you took them to the lake cabin or something, and they still can't relax. Or things that used to cause them to relax, they're just not relaxing anymore. or extreme anxiety. We're going to talk about anxiety here in a little bit, or panic, especially panic over some minor, what we might even term insignificant kinds of things. Folks that are under chronic stress often will have some types of panic symptoms over things that you might say don't really amount to a hill of beans. Like, why are they getting so panicked and anxiety about that? That would be a warning sign of chronic stress. Or feeling as if they're losing control over their thoughts and feeling, like maybe some impulsivity, or like usually it's out of the norm of how they are reacting to things in their environment, in their home or in school. That might be a warning sign of chronic stress. So where does the stress come from? It could be related to school, but it could also be related to exposure to family stress. And so family stress, which I'm going to talk about here in a little bit, but the effect suggests problems with emotional functioning, referring to their mood, their emotions, or behavioral problems. In young people, such as the picture here, you might see more arguing with their little or big brother or sister. They might be throwing things in their room, breaking things, throwing toys, breaking toys, leaving the house without, asking, those kind of behavioral problems, lying, not following rules, social competence, feeling like they just don't measure up to other people in their cohort. Cognitive ability. Cognitive generally refers to a person's thinking. So how well are they thinking? Their memory, their concentration, their focus. That's what cognitive or cognition generally refers to. And then their physical health. We'll talk a little bit later. I think there's another slide I have in here that refers to the mind-body connection. And there's a direct connection between how one thinks and their emotions and their body. One perfect example might be somebody that bites their fingernails. Why are they biting their fingernails? Probably because they're anxious, probably because there's something going on in their mind, and that leads to that physical manifestation. So there's a mind-body connection. You know that if you're under more stress, that can lead to like a high blood pressure. So that's what we refer to as the mind-body connection. Possible negative effects of stress could also be social and attachment difficulties. So they may have difficulties getting along with their friends, with their peers, with people in the classroom, with teachers they used to get along with. Well, they're not anymore. Just talked about cognitive deficits, but academic deficits. That I remember one time at one of my youngsters. I have 4 kids, but one of them was getting a D in gym. I was like, how are you getting a D in gym? Like, how is that happening? But that my young person was under a lot of chronic stress at that time. And that's what was leading to the difficulties, the deficits. And then I talked about emotional problems. Other common responses to stress in children as a depressed mood. Oftentimes people think of depression or depressed mood as just a person, with a box of Kleenex crying in the corner. But there's more to depression than that. And in fact, one of the common characteristics or symptoms you will find in young people for depression is an irritable mood, as they'll become more irritable and snarky. That's what you'll often see. Daydreaming, avoiding activities or avoiding other people, self-harm, suicide attempts. Obviously, we want to take those seriously. Perfectionistic kinds of qualities, suspiciousness and paranoia, constant worrying. We're going to talk about worry here in a few slides from now, and then school avoidance, which we'll be talking about. What other things can lead to stress in young people? Family structural issues, single parents. It doesn't mean single parents are bad. So I want to make sure I make that point known, that this is not what this is referring to. It just means being in a single parent home causes more stress. There's less money, there's less supervision. Chances are that single parent, the mother or the father being a single parent, likely is not living in a neighborhood that they would like. They'd probably like to be in a nicer neighborhood, but because of finances, they cannot do that. So that causes more stress. But in 82% of those cases, women are the primary custodian. And we already know from research, women get paid about 75 to 80 cents to the dollar of what men get paid. Less money causes more stress, which could carry over to stress in the children. 1/3 never married, 45% divorced or separated. Divorce, separation can cause increased stress. And with fathers, 20% have never married, 57% are divorced or separated. Again, all of those factors correlate to stress. What else can cause it? Stress due to faulty family rules. There was one theorist that called these directives. I think it was, I can't remember her name. I'll think of it after I go to bed tonight. She referred to it as family directives, meaning they're not like rules that are listed on the wall. That's not what we're talking about. They're directives that every child knows that their family has, that are kind of like lurking under the surface. So these are faulty family rules or directives, such as, well, don't be selfish, or do as I say, not as I do. And my family, it was, well, make us proud. You got to live up to these certain standards. Again, they're not rules that are listed on the wall. They're just known family directives. Okay, let's keep moving here. Other things related to faulty family rules, people who grew up with these directives, these rules, sometimes don't realize that many families allow you to talk about your problems outside of the family. There's another family directive, is what happens not what happens in this house stays in this house. Like what happens in Vegas stays in Vegas. Similar kinds of family directive is what happens in this house. You don't talk to anybody about any problems or anything that's going on in this house. That's a faulty family directive. And so expressing emotions openly or making mistakes without undue criticism, that's sometimes a foreign concept to young people, and that can cause more stress. This is what I referred to earlier, not the greatest picture in the world, but you can certainly find information about this if you research it a little bit more, just relating to the mind-body connection. What picture is referring to is stress can cause problems with the brain, with the heart, with the lungs, with your sweat glands, with your muscles, with stomach and intestines, with liver. I think of one example where I was seeing a young person many years ago that played basketball, and he or she was coming in for therapy because every time they would go through the free throw line, or every time they'd have to take the ball out of bounds, they'd start sweating profusely, and not just sweat from their brows or their head. Their hands would be completely sweaty. They could hardly hold on to the ball. And so that's the mind-body connection, that because of the stress he or she was having with regards to the basketball game, that was leading to body kinds of problems. And in his or her case, it was excessive sweating. Okay, mind-body connection. So common manifestations of chronic stress. I think I've alluded to this throughout the presentation so far, relating to depression and or anxiety. Just one slide, but I presented on this before with the Sioux Falls School District about the connection or correlation between social media or computer cell phone use and depression and anxiety. And so there's a ton of research out there now that says there's a direct relationship between digital media, meaning your Kindle, your tablet, your cell phone, your computer, and prolonged stress, depression, anxiety, and sleep disturbance. They're interconnected. Generally speaking, the best way I can say it is the more time you spend on social media, Instagram, TikTok, Facebook, the more time you spend on all of those things, gaming, the more anxiety and depression and sleep disturbance you're going to have. Stress, depression, and anxiety. Roughly 2/3 of children and adolescents with major depressive disorder also have another mental disorder. So similar data exists concerning depressed adult patients. What does this mean? It means that if you have a child in your school that has depression, they likely there's a 66% chance they have another disorder too. That's what that means. If they have ADHD, there's a 66% chance there's something else lurking in the background. And that can cause problems with regards to their abilities, their performance, their interactions, their relationships there in school. I won't go through, I could spend an hour talking about, or more, talking about each one of these disorders, but the DSM-5 is the manual that we use in our field of practice to determine diagnoses. And actually, it's moved up to the DSM-5 TR, the revised version now. And so these are some of the disorders that are under the anxiety section, the most common of which is social anxiety, generalized anxiety, an anxiety related to a medical condition, and I'd probably say obsessive compulsive disorder would be one of the more common ones. So GAD means generalized anxiety disorder. What are some of the risk factors? Etiology means how did it start? How did it begin? How did it manifest itself? Environment can cause that to happen, such as parental emotional problems, problems with attachment, meaning their attachment with their caregivers. So maybe dad got divorced, so they're having trouble attaching to dad's new girlfriend or his fiance or wife. Stressful life events, traumatic experiences, all of those things can place a child at risk for developing generalized anxiety disorder. Again, what does that mean? As a teacher, as an administrator, a school person, if I know a young person, their parents just got divorced, there's a likelihood that that could be leading to anxiety and or school problems. This is one of my favorite cartoons or favorite pictures, and there's truth behind it. It says research has demonstrated an association between parents with anxiety disorders and children with behavioral inhibition. Inhibition means I'm inhibited. I don't know if I want to do that. Like I might have inhibitions about speaking in front of a public crowd, in front of other people. And so this picture is saying first day of school at the top, and the parent, the mother is saying, whatever you do, don't let him sense our anxiety. Well, the kid senses that, and that could cause some inhibition for him to go into the school. How does that might play out? If I have a mother or a father that dropped out of school in 8th grade because they had trouble, with English or trouble with math, and they're afraid of going into school, that fear, the kids can kind of pick up on that, and that may cause some inhibitions for that child when they go to school. So there's a direct link there is what we're talking about. Tobacco smoking, that's been a risk factor for developing anxiety disorders. That's a whole nother presentation about vaping. Boy, that's rampant now. Boy, I don't want to get off track here. I mean, I've seen, apparently they have vapes that look like highlighting markers and all sorts of things, pins and whatnot, bringing into schools. It's really sad. But vaping and tobacco smoking is a risk factor for developing an anxiety disorder. So what does that mean? Well, kids, you want to, I see that you're vaping. You're putting yourself not only at risk for lung and heart disease, but possibly for an anxiety disorder or a mood disorder. Excessive caffeine use has been linked to anxiety. I'm talking more so not coffee, as much as those energy drinks. I have a cup of coffee over here on my desk and about 60 to 80 milligrams of caffeine. Some of those, one energy drink sometimes has as much as 300 to 400 milligrams of caffeine. So 4 to 5 times as much as you'd have in one cup of coffee. So if I'm talking to any parents out there, please don't buy your kids energy drinks. They're not good for them. The disorder develops gradually and can begin at any point in life cycle, although the years of highest risk are between childhood and middle age. So again, what does that mean? It means that I want to be careful that I don't increase the number of risk factors for my child, because that's when the etiology, that's when it can start, that's when it can begin. And the earlier it begins, the more likely it's going to be a chronic condition for that child as they move towards adulthood. Depression is the most frequent complication. About 46% of folks that have an anxiety disorder also have depression or a mood disorder. ADHD, I know most of you familiar with that. Misnomer is people go, oh, I have ADD. There's no such thing as ADD. The DSM 5 clearly indicates it's ADHD, and you can have a hyperactive component, you can have an inattentive component, or you can have what's called a combined presentation, which is ADHD with inattentiveness and hyperactivity. But no such thing as ADD. 20 to 40% of individuals with ADHD have comorbid anxiety disorders, means that they also have anxious features or anxious symptoms, and generalized anxiety disorder is the most common. Social anxiety disorder and GAD have similar features, but the perceived threat in generalized anxiety disorder spreads to various issues and areas. In fact, folks that worry, we're talking about anxiety disorder, sometimes they worry about their worry, and that's been termed as meta worry, that they'll worry so much that they start to worry about their worry. So not only am I worried about school, now I'm worried about that I can't stop worrying. And we call that meta worry. That's very common in folks with anxiety. Now, I may be talking to somebody out there. You may have a young person with anxiety. You may have a spouse or a sister or brother that has an anxiety disorder. Do not tell them to stop worrying, because if they could stop worrying, they would stop. Well, folks that have an anxiety disorder cannot stop worrying. They can't put it on the shelf. They can't. If they could do that, they would do it. So there's other things that we have to do with worry. And so first, let's talk about the 2 types of worry. Laducier and someone else up in Canada came up with this back in 1996, I think it was, came up with these 2 types of worry. And the first type of worry is modifiable worry that's in the here and now. I got to get some groceries. I need to buy some new school supplies. I need to update my resume. I need to get my car tuned up. Well, that's modifiable worry. You can problem solve that and figure it out, and go to the car dealer, go get some referrals, figure out what I need to do, look at my budget. I can do stuff about that. I can problem solve it. That's usually not what folks with anxiety disorder have problem with. It's the second type of worry. Well, first, let's finish talking about modifiable worry. Modifiable worry, you problem solve it. I got a little bit ahead of myself. And so this is a picture of the problem solving process. The second type of worry refers to intolerance of uncertainty. And what this refers to is the unknown, the future, the what if. What if these medications don't work? What if my teacher doesn't like me? How am I going to get to school? What am I going to do if I get to college and I don't like my roommate? Well, that's called intolerance of uncertainty. And you can't try to problem solve that kind of worry. You have to use coping skills. And so we have to accept and implement coping strategies when faced with uncertain situations. And so that's what you do. So if you have a student that's worried about going to college, well, you can't try to problem solve that with them. Well, Billy, if you do this and do this, then you won't worry about that. No, that's the future. They can't problem solve that. So you have to use coping skills, diaphragmatic breathing, relaxation, yoga, exercise, scripture, prayer. Those are the kinds of things you have to use for intolerance of uncertainty. And one of the worst things people can do is try to problem solve intolerance of uncertainty. You can't problem solve the future. You can't problem solve what's going to happen in the next election in November. That's intolerance of uncertainty. You can't problem solve that. We can only hope for the best. Pray about it. Just do the best we can. And so here's some examples of some things folks can do with intolerance of uncertainty. I think we got close to 3 to 5 minutes, so we're going to be finishing up here pretty quickly. Intolerance of uncertainty is imaginary exposure to what's going to happen in November. Using a SUD scale. SUDS means subjective units of distress. Means on a scale of 1 to 100, how much stress am I under right now, with 100 being the highest. Conduct a cost-benefit analysis, meaning how much does this benefit me to be worried about this? Worst case scenario. And so we're going to finish up here real quickly, is talking about the negative reinforcement cycle. This connects to our primary topic today about school avoidance. And so what happens is a young person, anybody, there's an event, something that happens to them, their breakup with their girlfriend, or a poor interaction with a colleague or a teacher. And so something happens, and that leads to distress. And so then when I'm more distressed, I become anxious and worried and frustrated and angry and hurt. And so then when I'm distressed, what do? I avoid. I avoid school. I skip school. I don't go. I don't go to that class. I hide out in the principal's office. I hide out in the counselor's office. And so with that avoidance, what happens? It leads to temporary relief. So because I avoided something and that led to me feeling better, temporarily, that's what I'll do. And that's what it means. It becomes negatively reinforced. A negative behavior, which is avoidance, becomes reinforced. Why? Because it works. Because it causes some temporary relief. But it only works temporarily until they come back to school the next day and they're behind in their schoolwork. So what we want to do to interrupt that cycle is we want to stop the avoidance. And when they're distressed, we want to zero in on some coping skills. Referring to school, one of the primary, and I don't want to steal anybody's thunder, hopefully I'm not stealing thunder here, is peer support. Research has clearly shown having peer support, since with teenagers and adolescents, they tend to listen to their friends more than they listen to adults. Well, then use those other peers as a support system for them. And here's some other coping skills that I listed in this box: cognitive behavioral therapy. Use the coping skills to provide temporary relief instead of avoidance giving the temporary relief. So we're finishing up. I got about a minute and a half here before I get to my time limit here. We have to learn to recognize our stress. What are our signs of stress? Start recognizing what some of those physical manifestations are. For me, it's usually like my shoulders getting tight, or I'm, balling up my fist. I get tight and start clenching my jaw. What are some of your signs of stress? And then once you know what those signals are, you can start to manage them. You can also identify situations that cause you stress. Obviously, those are called stressors. Mine is Costco or Sam's Club on a Saturday afternoon. So know what some of those stressors are. And so once I understand where that stress is coming from, I can maybe learn how to deal with it a little bit better. CBT, you've maybe heard this, it's cognitive behavioral therapy. Find a clinician, maybe, if you know someone that has anxiety or depressive disorder, find a clinician that is well-versed and experienced in cognitive behavioral therapy. There's over 400 different types of therapy. CBT is one of them, and it's been shown from research to be one of the most efficacious or beneficial therapies to treat depression and or anxiety. It refers to how thoughts connect to emotions, emotions connect to behaviors, and behaviors connect to certain thoughts. And here's another list of other possible treatments or coping skills for anxiety. I referred to these a little bit earlier: journaling, distraction, self-soothing, prayer, scripture, mindfulness. Those are some of the things that we might be able to do to help with our anxiety. And so here are some references that you could refer to if you want some additional information about some of what I've spoken about today. And then I just want to thank you for taking the time to look at this presentation. Hopefully you have the opportunity to talk with your colleagues or your friends or your family or your young ones about some of this. If you have an individual in your family or it's your child, I'd strongly encourage you to get them some help if they have some anxious or depressive features, or you see some of these signals or signs I've talked about in the presentation. We'd be more than happy to work with you. At Avera, I've left a phone number here at 322-4005. Contact our intake offices at our behavioral health outpatient clinics as well, and we'd be more than happy to triage and find individuals that might be able to help you or help your loved one with some of these issues. Thank you very much, and I appreciate you taking the time to look at this presentation.
Good evening, and welcome to this evening's Family Forum series, presented to you by Avera and the Sioux Falls School District. We thank you for being part of the Avera Family Series, where we work to strengthen families and provide you with information that can help support you and your children as they attend school. I'm joined this evening with two individuals from the Sioux Falls School District as we go through and talk a little bit more about attendance and the impact of attendance on students as they go through their school life. And so we thank Dr. Jackman and Avera for their presentation, but we just want to bring that home a little bit more with some of the individuals as we talk through the school side of things. So I'm joined with these two individuals. I'll let you introduce yourselves.
Hi, I'm Kristen Skogstad, the principal at Garfield Elementary School.
I'm Joshua Smith. I'm the Freshman Academy Coordinator at Lincoln High School.
And my name is Jamie Nold. I'm Assistant Superintendent with the Sioux Falls School District. Well, we'll get started here right away and just go through and ask a few questions to be able to help you as family members to be able to work with your child on attendance. We'll start out here at the elementary level. So as we really look at some of our youngest learners, can you talk to us a little bit about the importance of elementary students and their attendance in school and the impact that it will have on them?
Sure. I would say the most important thing when we think about our youngest learners is that they are learning how to navigate school. They're learning all about getting along with one another, and that social interaction piece is very important. And if kids aren't at school, they're missing out on those opportunities to learn and grow together as a team. Much of our curriculum is very based with communicating with one another. There's a lot of collaboration that happens, and if kids aren't at school, they're missing that. It also is the time when we're really focusing on foundational skills for our students, and each day that they're at school, they're learning something new, and so the foundational pieces are very, very important as well.
Yeah. And at the high school level, and Mr. Smith, you're the coordinator of our freshman academy at Lincoln High School. And so, at the freshman level and the high school level, there's a great importance on that as well. But if you can just share with us a little bit of an impact that you see on attendance, whether it's good, great attendance, or someone that is missing more school days, the impact that'll have on a student in their high school career.
Yeah. So one of the things that we share right away with parents and students when they come in for PST night is just the importance of three things: showing up on time every day to every class, doing the work, and just being a great person. And we know that foundation is attendance. And so when a student isn't at school, one of the big things that happens is they get behind in what the classes are doing on a daily basis. And that learning is impacted then in their grades. And when we don't have the grades, we don't earn the credit. And when a student doesn't earn credit, generally speaking, they have to take the class again. We get behind in our credits, it's less likely to graduate on time and earn that diploma. And I mean, really what we're trying to do is set a foundation for the rest of life with that learning. And when a student doesn't have that diploma, they lose out on all those opportunities that can lead to higher success in life with furthering their education if they choose to do so, or if it's jobs straight out of high school. When you don't have the diploma, it really impacts the rest of their life.
And we see that at the high school level. Kids are probably a little bit more independent at the high school level, but yet they still all have parents and guardians that work with them. What advice would you give some of those parents or guardians, especially if they're seeing some of their kids maybe start to tip into a little bit of that and missing more and more days? But what advice would you give to some of the parents?
Well, we talk about it's a parent partnership between us and our teachers. When we in our freshman academy model, we use a team approach where the teachers meet on a daily basis and they discuss students, try to develop intervention plans. And when we talk to parents, often it's really about what can we do to help your student be successful. And when students are gone, we have a period in the day called WIN. It stands for What's Important Now. But really it's an intervention time that it's allowing the teachers and the students to be together. All teachers are available at Lincoln High School during that time for every student. And a lot of times it's a reteaching time, or it's an opportunity to take a test or a quiz. If they didn't do well on a test or quiz, it's that intervention time to really build them back up again and teach them those skills that they were missing. And so for us, it's that partnership with the parents to talk to them about, hey, we want this student to be here at this time to help them. And it's really about learning. It always is about learning. Sometimes we talk about grades and credits, but if a student's learning, they're gonna get that. And so the attendance is the most critical component and the foundation of that.
Yeah. And we see that at each one of our high schools where they have some type of a freshman academy, either a true freshman academy or some offshoot of that to really help the parents and help them to be successful at that first year.
That's right.
At the elementary level, high school, they're very independent and they're starting to gain some of those techniques to be independent and travel, driving their cars and things like that to school. Elementary can't do that. They just don't have that ability to drive themselves to school, so they're really reliant on their parents And sometimes parents have some struggles, some different things that may happen in life and need some help or some resources. What are some ways for parents to be able to gain access to some of those resources or to get that help?
Sure. We are very lucky to have many resources available to our families, starting with our social workers. They are a wealth of knowledge and have lots of insight on how families can get the support and help they might need in order to get their kids to school. We also have a Native American liaison, and we have an attendance liaison, and we also have our ELL liaison who help our families who seem to struggle with being able to get their kids to school on time. Sometimes it's just getting an alarm clock to help them to get the kids ready to get on the bus or to get them in the car and get to school on time. One thing that I think is very crucial is that if parents are struggling or they're having trouble getting their kids to want to come to school, it would be important to reach out to our school counselor. They have lots of little groups that they've started at school to get kids to feel included and want to be at school. We've also encouraged our teachers to start the day with something very engaging so kids don't want to miss out on that, and they want to be able to come to school to see what exciting things going to be happening in my classroom this morning at 8:05. But the most important thing is that if there's a struggle, parents just need to call because our community wants to help. And it's nice to be able to say our community cares and wants our kids in school. We have these opportunities for you.
What role do parents play in that? I mean, how critical is a parental role in their child attending school?
Yeah. Well, so I did a little math, and as a high school teacher is with a student, I believe 172 days is how many days they're in school. Yeah. Is that accurate?
Yep.
Mm-hmm.
And so for a high school teacher, they see them one period a day. That's 172 hours that high school teacher has to impact a student's learning on that subject. And so we know that parents have been part of that educational journey the whole way, since they were just toddlers trying to start to learn how to read, and were being read books as children. And so they know how their student learns. They know how their student responds to certain stimuli or how they respond to certain interventions that teachers have used through all the years. And so for us, that partnership is huge. Yeah. And that's what we use, that team time to call them to visit. But I would even say it's really important for for parents to reach out to us and just share what you know about your student with us, because it just builds a foundation for our understanding of how to work with your individual student. Every person's different, and every person learns a little bit differently, and so that value in that parent relationship is just critical.
Yeah, very good. Yeah.
I would agree at the elementary level, it's very much the same. We start building those partnerships at the beginning of the school year when we have open house, and just so that the students can see we are a team, and we talk about that a lot. We're all a part of your learning team. We want to help you reach your goals, and in order for you to reach the goals, you have to be here on time and ready to learn. And part of that is your responsibility, and parents, that falls hugely on them at the elementary level.
Yeah, and there's a lot of people that care about them, and sometimes it's some tough love to make sure to get them there, but there's a lot of people that care about them and want to help. Some individuals that will be watching this evening won't have kids in school. And so we talk a little bit about mentors and the importance of mentoring and what that can do in the life of a child. And I know I've been a mentor with a couple different individuals, but your experiences at the elementary or high school level on the importance of mentors.
Yeah, mentoring is huge. There isn't a day that goes by that a child doesn't ask for a mentor at Garfield. And so there's a waiting list. They want a mentor, and the mentor is another person that's in their corner cheering them on. And kids want to be at school, especially on those days when they know their mentor's coming. But the mentor program that we have here in Sioux Falls is always in need. So I would encourage anyone to become a mentor.
Yeah. I think the value of it is in the transitioning period between probably elementary to middle school and then middle school into high school. And where I see it a lot is a lot of our students that are maybe considered at risk of not graduating, a lot of times have had a mentor that's just helped them get through something that the school maybe didn't know about, or the student wasn't willing to share it at that point because they just didn't have the relationships with that staff because they were transitioning into a new school. And so some of our students are coming in already with the same mentors they've had since elementary school. And so I just think that's awesome. That's a really cool thing that our community has done to help specific students. And like you said, there's students that still ask for it. Like maybe their mentor moved, or they just moved in from a community where they had one, but they don't have one now. They're asking for it as freshmen. And you think about a 14-year-old knowing what they need. They don't always really know how to get through a situation, but they know that they need someone to help them, and they ask for them. Yep.
And that could be a great asset for parents.
Yeah.
You know, and parents shouldn't be afraid to reach out for that. It's just somebody else there to help as an adult. So, any other things you can share with us in closing on the importance of attendance and some of the things you've seen, or even success stories that you've seen with individual students that have turned it around?
Yeah. I think at the high school level, I've asked a lot of students this over the years, and they've been in really difficult situations in life. And I just asked them, how'd you get through? How'd you make it through high school when your situation was maybe pretty dire, and maybe you as an individual were looking at it as, I'm not going to make it through high school, I'm not going to pass this class, I don't want to come to school. And I just asked them, how'd you get through it? And oftentimes it's that one relationship. So whether it's a mentor or a peer mentor or peer tutor, or that one teacher that built a relationship with them, but the critical part of it is that they decided to come to school.
Yeah.
That student decided, I'm going to come to school and I'm going to get through this. And then I can say to pretty much everybody that if you come and you show up and you do the work, the teachers are going to find a way for you to learn the content, even if you're struggling. They're going to find a way. We're super proud of our teachers and our staff and our students, and we want every student to be a part of that.
Agreed.
I would agree with you 100% on the fact that the relationship is such an important factor for our students, and it is what gets them to school. Many times when we have kids struggling with attendance, it's not that they don't want to be at school, because they do. It's just that the family may have run into a bump along the way and can't get them there. I would encourage families, if you oversleep, it's okay, come late, but get your kids to school. Oftentimes they'll say, well, we overslept, so we just didn't come. But every minute that kids aren't in school, we miss them, and they're missing out on learning.
Yeah. Well, very good. I thank both of you for being here with us today, just to shed some light on the importance of school attendance. And I agree, we have so many resources in our district that if families need help, we'll help them. We just need to have their kids there, and we'll build those relationships and get them their education. So one of the things that we strive to do in Sioux Falls School District is to keep all those absenteeisms under 10%. And I know that sounds like a lot, but it really equates out to just 2 times a month. If a child's missing twice a month, we see such an increase in the chances of them not being able to graduate, or other things that will impact their reading and their social skills. So, but we thank you both for sharing some of that information with us today, and greatly appreciate you being here. So,
thank you.
Well, thank you again for joining us in this Family Forum series, and we again thank Dr. Jackman and Avera and their partnership with us to make sure that we can bring this for our families to benefit you. So again, we'll be with you each of those Tuesday nights each month, and we'll bring a new series to you each month, and we thank you for tuning in. Have a great evening.